Welcome to my podcast. Today I'm going to talk about another common case. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask the patient, how can I help you today? So the patient usually is a young girl or a boy or middle age as well. They might complain that, oh, doctor, I'm having ankle pain and it's really disturbing and impacting my walk and affecting my life. So I need to ask the patient, tell me more. So the patient says, I waked up with this pain. I can't to relate it. I took painkiller, doesn't work. So you will try to inquire if there is anything that might the patient knows what caused this pain, and is it acute or chronic or a gradual one. And you will ask if the patient had the pain on and off, or it's constant, continuous, if there is any throbbing associated with that, if there is any redness, swelling, if there is any history of trauma, or a sprain or a fall, and also inquire what kind of a shoe basically the patient usually wear, if it's a tight, if it's high heel, and ask if there is any popping sound or snapping felt when the patient had this pain, if it was associated with injury at all, and if it's causing any difficulty basically in the walking. And you need to ask about the pain on the scale from 1 to 10. Where would you rate that pain? And if it's affecting their sleep or if it's awaking them from sleep. So all of that you need to ask, and you will ask if the patient exercising or running or jogging, all of that. Ask the patient what sort of work they do, if they're having prolonged standing, for instance. And also then you need to inquire if there is any past medical history that you should be aware of, if there is any medication they take for on the long run, and if there is any family history with certain disease that could be running in the family, and if there is any known allergy. And also don't forget to ask about lifestyle of the patient and smoking and the drinking habit. When you ask all of that, you need to ask the patient if he's happy to be examined. So you will ask the patient to expose the area and have a quick look and a feel and a touch for the level of the pain, if there is any swelling, and also look for the if it's warm and if it's red, and check for the pulse as well. And then you will advise the patient after agreeing about the management plan. So it's basically like rising. So basically the patient need to for rest and raising the heel from the ground. So basically you could put a pillow on a horizontal thing, in front of him or her if she's sitting in a sofa. So she could put a pillow under her heel on a table or anything beside her. If there's any swelling, so you'll advise about ice packs. So it's basically frozen piece wrapped in a towel and applied for 20 minutes and can be repeated every few hours. Also ask the patient to wear any comfortable shoe, and usually flat and low heel, and avoid any high heel, especially in ladies, and certain men as well, they wear high heels. Also ask the patient, they can wrap a grip bandage around the ankle, which could support and ease the pain as well. And try to do certain gentle movement of the ankle in order not to be stiffened. And also advice about painkiller in the form of tablet like paracetamol, ibuprofen, Voltaren, or in the form of gels like ibuprofen or Voltarol. You need to tell the patient avoid prolonged standing and avoid putting pressure if it's too much pain in the ankle, and also avoid any high heel or tight shoes, certain shoes that are very tight on the ankle, and some are pointed from the forefoot. So all of that will affect the easing of the pain. And of course, you will tell the patient if you need to safety net always. Never forget safety netting. So if there is anything doesn't seem right, or the pain is not improving, or you feel it's increasing, you need to either come back to the surgery or go to the A&E if you felt that the condition is intolerable. If the patient has, for instance, in the past medical history, it seems that he is diabetic and had foot pain, so you need to take things more seriously, advise about the cleaning hygiene of the foot, and advise the patient to look between the toes. Sometimes they might have fungal infection, they might have any injury there. Inquire about the sensation, if they have any, they can feel in the area, because sometimes the patient might have injury or any of that, and they are not aware of that, so which would imply loss of sensation in the area and nerve affecting. Also, as I mentioned, when you inquire about the level of the pain, you will ask if this pain keep them up, if they are not able to move around or wash or dress. So all of that will show the level of the pain. And by that, you could narrow down, of course, the differential, and according to that, you could, of course, treat the patient accordingly. So by that, I hope that I covered the main differential of causes of ankle pain and how to approach them effectively. Thank you.